out of those total, those 80, we had 30 staff roughly that ended up taking the program, meaning that they applied, they were approved, and either they are on leave currently, administrative leave, and they remain on our rolls to September 30th, roughly. And so you'll also see on that same line that there's been some hiring freeze exemptions that were as a result of the incoming administration's review of occupations throughout the federal government. And so I'll talk a little bit more about that towards the end as well. We also had another program that was called VERA, which is the Voluntary Early Retirement Authority, that you've likely heard of either through the VA channels or other channels, was a retirement opportunity, an early retirement opportunity that was offered to the VA. And so we had 6 of our staff that applied for that program. And ultimately, we were not able to approve any of those because all of those occupations that applied were in mission critical occupations to our healthcare system, as clinical operations or our general hospital operations. And so approving those applications would have had an adverse impact on veteran care, the quality of that care, and or our hospital operations in its totality. Moving on to the hiring freeze exemptions, which I alluded to a little bit earlier, we are now at phase 3 of those exemptions, meaning that the VA, the Secretary of the VA more specifically, has approved exemptions for roughly 350,000-ish of our VA occupations. And so roughly 350,000 or so out of the 450,000 plus staff are in occupations that have already been exempt from the hiring freeze, meaning that those positions are critical to our operations, delivering safe and quality care to veterans, and or hospital operations in general, such as the people that keep our hospitals clean, known as our environmental management service staff, our nutrition and food service staff, some of our administrative roles as well that might have some direct impact towards hospital operations and or clinical operations. And so we do expect another round of those hiring freeze exemptions to be approved over the next several weeks. So in the very near future, we expect another round of exemptions, and that will bring us to 4 phases of exemptions that have been approved. And so you can see that the Secretary and the VA leadership and the administration has been really focused on not adversely impacting veteran care as a result of some of the workforce initiatives and workforce reductions that are going on across the federal government. And that's great news for us. That's great news for veterans. That's great news for families, caregivers, and survivors. Next slide, please. Okay, so this is a continuation of what I spoke to on slide 1. And so I would just like to draw your attention to the fact that here at the Dole, a lot of the workforce strategies and continuous process improvement initiatives and other sort of cost-saving, cost-cutting initiatives, along with gaining more efficiencies in our healthcare system to deliver better care for you, our veterans, their families, caregivers, and survivors, has really been always predicated upon those first 3 bullets that you'll see on the screen. And so for systems redesign projects, we focused a lot on those types of initiatives over the past several years. We've also focused a lot on continuous process improvement initiatives, such as rapid process improvement workshops, when we notice that there are some system vulnerabilities that could lead to veteran harm or that could lead to staff harm or staff being in an unsafe environment. And we empower our staff as a high reliability organization to bring those things up to our attention, but more importantly, to address them on the spot if they are able to do that. If they're unable to do that, they indicate the support that they might need from some of our leaders, our senior leaders across the organization, to include myself. And we have various mechanisms and forums to gain that type of feedback from our staff through speak to the director sessions. We also have what we call joint patient safety reporting tools. We have other venues where staff can report safety related issues or concerns, and you, our veterans, can also report those types of concerns that you might be aware of through our Speak to the Director forums, through talking to some of our executive leadership team members, talking to your providers, anybody in our staff, because everyone is a safety officer here at the Dole. And we challenge all of our staff, regardless of their roles that they might be in, that if they see something, say something, especially if it's inconsistent with our values and our norms, and being able to deliver on our promise to provide high quality and safe care to you, our veterans. And so, in addition to that, I would also like to point out that we've also been in the middle of what we call a return to office mandate that every single federal agency has been under with the new administration taking over. And so to date, we've not had any staff that have not been placed as a result of that return to office mandate. And so we are continuing to look for ways to create additional parking. We've added 129 additional parking spaces out in our front lawn. We also are looking at other areas to decompress parking, to allow some additional parking for veterans that are closer to their areas where they have appointments at. We're continuing to challenge the status quo in that space, and we're also looking for ways to ensure that our staff are working in safe spaces where they have confidentiality, where PII and PHI isn't being compromised. And to date, we've not had any major concerns at our system as a result of those return to office mandates. We have housed some of our VISN, which is our regional office staff, and some of the national program office staff as well, as they might reside in either our Wichita catchment or our catchment where some of our community-based clinics may be. And we are still looking for ways to continue to partner with the programs for that if there's any unmet needs. Finally, to date, we've not had any impact as a result of the DOGE contract terminations. There's also been a lot of media and a lot of misconceptions out in the podcast space, in the traditional media space, but also in just initiatives I spoke about have been, will continue for the next couple of years and subsequent future years. And so it was great to have the Secretary of the VA, Secretary Doug Collins, that participated in that session with us last week. So he was able to hear from us directly on some of the challenges that we're experiencing at our local hospital systems. He was also able to share some insight and some perspective into some of his leadership strategy and his vision and sort of some program high-level initiatives that are going on across the VA. And happy to report that as a result of that meeting and actually leading up to that, the announcement came out on Monday, which is the day we were headed to that the secretary indicated that a large-scale RIF for the Department of Veteran Affairs is no longer necessary and that is off the table. And so while we are not done reforming the VA, and while we are not done making changes and making efforts to improve care and delivery for our veterans, families, caregivers, and survivors better. This gives us some relief. This gives our staff a lot of relief because they've also been party to some of those conversations regarding workforce reductions and not knowing which occupations were going to be cut from the organization. They've been sort of managing a lot of anxiety, managing a lot of emotions, and just really the fear of the unknown. And so you all as well. So I've heard from many of our veterans and their families or caregivers and survivors about how they've also had to deal with a lot of the uncertainty and how that's impacted them perhaps coming to our system to choose care, how they might be impacting a provider that they may be used to seeing and that's been providing care for them for a very long time. And so the good news is that for us in the VA, we don't expect any large number of our staff to leave the organization at all. And so by September, we expect the 30,000 staff or so that's been announced to roughly be cleared off of the rolls as a result of those other programs that I talked about on slide 1, which was the deferred resignation program and the voluntary early retirement authority. And so that should be a relief for us all. And so that again highlights the priority that the Secretary has placed on keeping veteran-centered care at the center of what we do, prioritizing veterans and their unmet needs and their healthcare needs by keeping our staff in place, but perhaps more importantly, continuing to allow you all to know that you can come and continue to come to the Dole healthcare system and get the same care that you were receiving prior to last year, and that service should be top notch. And so that wraps up my portion of this presentation, and I'll pause for any immediate comments, questions, or concerns that any of you might have. Okay, I just want to say thank you for everything that you've done for our country. You simply are the best, and you represent the best of what our nation has to offer. It's an honor and privilege for us to serve you here at the Dole, and we look forward to seeing you in the near future. Back to you, Mr. Kimball. Thank you.
Thanks, Mr. Payne. Very glad that you're here. And just to reiterate, he has been extremely transparent with staff and with the community about happenings since the change in administration. So we all very much appreciate that. So as we move forward, Dr. Zubair Hassan is our Chief of Medicine, has been instrumental in bringing 2 new important services to the veterans we serve here at Dole VA. He's here this morning to let you know how these services might benefit you. Dr. Hassan.
Good morning. Thank you for giving an opportunity to talk about the programs we have done in our medicine service. So one of the things is about ionic robotic bronchoscopy, and this is an update on how to improve the diagnosis on our lung cancer screening program. Next slide. So important about lung cancer screening is a lethal disease. Most of it is picked up late, diagnosed late, and lung cancer screening program is the only approved modality for screening it using low-dose CAT scans. And it has been found that if you pick them early, it leads to 20% fewer cancer deaths. Next slide. So the eligibility, you see people who are 50 to 80 years old, they are smokers, less than 15 years, quit less than 15 years ago and have smoked about 20 pack years, and life expectancy is expected more than 5 years. Next slide. So we started this program in 2019 until beginning of this month. We have enrolled about 3,448 veterans, and about 1,780 patients are actively monitored. We have done about 700 CTs, and we have diagnosed 116 lung cancers. And the important thing is that about 64% of them were early stage, which is what we want, so that these patients are eligible for definitive treatment, which is surgery. And adherence, which is that people come back for a subsequent screening, is about 93%, which is the highest in our vision and higher than the national average, which is about 80%. Next slide. And this is the one once we screened these patients, we pick up these smaller nodules and how to make a diagnosis of this in a safe manner. Traditionally, we have done what we call CT guided biopsy, put a needle in the chest and get a sample. But as you know, it causes complications, collapse of the lung. So we are looking at measures which we can do to prevent those. Next slide. So we use this what we call as a robotic-assisted bronchoscopy, and it minimizes complications. You put in a tube through the mouth into the lungs, and it uses what we call as a Google Maps. For us, it gives us track where this nodule is, and we can pick it up. And the rate of collapse of the lung is very less, about 1 to 3% compared to 20% with a CT-guided biopsy. Next slide. And this is a picture of it, and it shows that we plan it on the computer, and then the blue line shows us where the tumor is. It guides it exactly where the tumor is, and then you put a needle there and take a sample of it. Next slide. So we have started this program in May of this year, and we have done 6 cases so far. And this is a picture about the different centers within the VA and the Department of Defense where this program is. And you can see the red mark in the cancers. We are the ones we have. Next slide. Any immediate questions on this one? And if not, the other program which we have initiated is what we call as a home-based cardiac and pulmonary rehabilitation program. And we are getting support from it for the grant from the Office of Rural Health. Next slide. So just the background on it, as you know, heart disease is the leading cause of death, and pulmonary disease, which especially COPD, is the 6th leading cause of death. And the veteran population has a higher rate of both heart disease and pulmonary disease. And especially people who live in rural areas, they have a higher rate of these COPD and heart failures. Next slide. So studies have shown that if you do rehabilitation of these patients, it has improved health, improves quality of life, reduces risks of readmissions, and reduces morbidity on these patients. And it's a component that includes exercise, nutrition, medication management, tobacco cessation, and stress management. Next slide. And so we want people who are eligible for it, mostly patients who have for cardiac rehab, or patients who have had a bypass surgery, had a stent placed, had a heart attack, heart failure, which is stable. They have chest pain, but so stable, valve replacement, peripheral vascular disease, and coronary management. And the patients who are eligible for pulmonary rehab are patients who have chronic COPD, emphysema, pulmonary fibrosis, lung cancer, or people who have had lung transplants. Next slide. And it goes over the cardiac, goes over the eating habits, look at their dyspnea, which is the shortness of breath, depression, quality of life, and make sure they're taking their medications and weight management of these patients. Next slide. So utilization of this in the community, if you use the Medicare population, is about less than 25%. And patients who participate in more than one session is 2%. As you know, people start it initially, but they drop off. In the VA, about less than 10% of the patients participate in this, only about 3% of chronic heart failure patients. And then barriers are, as you know, program availability, reimbursement, other things, transportation, especially for rural veterans. Most of these programs traditionally have been in bigger cities and towns. Next slide. So the VA in Iowa has been a pioneer on this, and they developed a program on this, and we participated in this program, and we got a grant from it to start in our VA. Next slide. So these are the centers in the picture where we are. The red arrow in the middle is Wichita, where we are providing both cardiac and pulmonary rehab. We got the grant last year, and the first patients was seen last month at our VA. So basically, it is the patient will be at their home, and we have a respiratory therapist who works with them, interacts with them, providing them some devices, exercise devices, and coaches them about this program. We are planning to, if we started with the pulmonary program, we're going to expand it with the cardiac rehab program also. Next slide.
I think that was it, Dr. Hassan.
That's it. Okay. Any questions for me? Immediate questions?
Doesn't sound like it. Thank you very much, Dr. Hassan. Appreciate that. During our January Veterans Town Hall, Dr. Scott Hood, chief of our pharmacy, discussed the new Audio Care pre-fill system in the pharmacy. Well, our pharmacy never stops being innovative to support the veterans we serve. So today, Dr. Hood is here to share the latest with you. Dr. Hood?
Yeah, so yeah, we're doing a lot of exciting things here with new technologies. Like you said, we've got the audio pre-fills. We're just finding ways to make our veterans' ability to get their medications quicker and easier. I'm actually going to hand the presentation over to Clint Owens, who's our Associate Chief of Pharmacy that actually put this program together. He's going to kind of talk to you about this new paperless medication education program we have.
Excellent. All right. Yes. Thank you, Dr. Yeah, so we're excited today to talk about this new feature. That'll be on our prescription labels, as you see on the example here in the bottom right, around that red box is a QR code. So these QR codes are a quick and easy way for you to access important information about your medications. The Department of Defense started using these codes in 2021, and they've been a big hit. Asheville and Columbus VA medical centers implemented these last year, and veterans have reported finding them incredibly beneficial and luckily easy to use. Next slide, please. Now, the goals here are to better protect your information. Many of you have mentioned that there's too much paper included in the prescriptions, often containing personal health information that can end up in unsecured bins or sometimes scattered around our facility. Now, by using QR codes, we can minimize this risk and keep your information safer. It also reduces waste. Our pharmacies use a lot of paper and toner each year, costing us around $40,000. By using QR codes, we'll cut down on this waste and be able to use it on more veteran services. And then we're also able to improve care with this. Some of our pharmacists processing this paperwork, they have to wait for it and then fold it. It eats up about 10% of their day for the pharmacist performing this. With these QR codes, they'll have more time to focus on what really matters, providing you with the best possible care. Next slide, please. This is some of our marketing material that you might see in your prescriptions going out. This is a little step process on how to utilize these QR codes. And we're going to have a demo right after this if you might have your smartphone handy. So basically, we locate that QR code just in the bottom right of the prescription. We open up our smartphone's camera and just look at the QR code with our camera. We'll hold it. You'll have a screen here, but we generally hold it about 6 inches away. And then a little pop-up link below it shows up. We click that. Yeah, so go ahead. So as you see here, if you can go back to that demo screen, that's the QR code. If you have your smartphone handy, please take that out and use your camera and see the link that it pops you up to Lumistream. It'll actually take you to the medication methocarbamol for this one, and it'll have a medication video as well as a medication guide and any other fact sheets on there, as well as our pharmacy contact information. And unlike paperwork, which sometimes we can misplace it or put it in the bin, it may not have it when we want it. This is always available with as long as we have that prescription vial with the QR code on it. I'll just wait a moment longer. And if we could go to the next slide, please. And now, so digital access is the concern. In 2016, there was a report and that was about 9 years ago, where 80% of veterans reported having internet access at home, while 98% owned a smartphone. So those numbers are expected to have gone up since then. However, for those who prefer or need physical paperwork, it will still be available upon request, and you can always opt out of this QR code system if that works better for you. If anyone has any questions about that, pharmacy is always available. You can see us here in person. You can give us a call. We're happy to assist. We will be rolling out with this sometime toward the end of this week or next week. We'll be going live. Thank you.
Thanks, Dr. Owens and Dr. Hood. Appreciate the information. Like I said, they do such a good job on technology and being innovative for our veterans that, it's really appreciated. And I was just getting ready to type into the chat that it's a great use of interactive demos, getting the audience involved. So works great. Thanks for giving us that information. Next, we wanted to share some updates from our homeless veterans program, including an upcoming event that we're all pretty excited about. Kenny Barker, our homeless program supervisor, is here to share that news. Kenny?
Yes, thanks a lot, Gene. Lots of exciting things happening for homeless veterans in our community. But I want to first start off by sharing we've got several metrics and things that we focus on to help reach lots of our goals within addressing homeless veterans and their barriers to get into housing. But one of them, I'll speak on a couple of them this morning, but one of them is our progress towards reaching functional zero for veteran homelessness. This is an initiative that started years ago now, but we are happy to report some updated numbers and where we're at on that. To remind those of you who aren't familiar with functional zero really means keeping homelessness for veterans rare, brief, and non-recurring. It's an opportunity for us to build a system that better serves those who are in our community that are experiencing a night or several nights in some cases of homelessness. And so as we review our systems and break through barriers, we understand that it's not ideal that we can get to that actual zero, but functional zero is not about getting to zero homeless veterans. It's about building that system to serve veterans in our community. So happy to report as of January of this year, we were at 44 veterans on what we call our by name list, which is a list of those who we know are in our community, in our shelters or an unsheltered environment, and are experiencing homelessness. As of the beginning of this year, we had the 44 veterans on that list. And then as of the end of June, beginning of July, that number was down all the way to 24, showing a 45% decrease and really a clear sign that we're really heading in the right direction. To kind of expand on that, just to give you an idea of what this system actually means, it means we've got a weekly case conferencing that exists within our community where we have over 15 different agencies and over 40 different providers meeting weekly to discuss each and every veteran on our by name list. So we walk through this list to ensure that we're breaking down barriers. So if we're missing IDs, we're making sure that appointments are getting scheduled to get those IDs done. If we're needing consults completed within the VA system, we're getting those put in at ASAP. So care is being delivered and movement is being made. And so it's an opportunity for us as a community to come together, not just the VA, but we've got partners across Wichita and Sedgwick County working towards this initiative. We've noticed over the years of doing this that there's certain small little things that we can tweak and areas that we can improve upon just to make some very important advances. So we're excited to share this update. We know that the numbers can fluctuate as time goes on, as we get new veterans that come into our community or that we've identified through outreach, but we're definitely excited to see the progress that we're making so far. So next slide. So I want to talk briefly also about other goals that have been set for our community and set for us specifically. Back in 2022, the VA secretary at the time put together with the team in the homeless program office with the VA and the United States Interagency Council on Homelessness a goal. It was a laudable goal at the time to house over 40,000 veterans, and that number just climbs each year. So National asks us as a community to take a number of those veterans and do our best to reach that goal. So I'm happy to report each year that we've had a goal in our community. We've not only reached that goal but exceeded it. And so one of the major goals is obtaining permanent housing for veterans in our communities and the veterans in our whole catchment area, not just Wichita, Sedgwick County, but the over 50 counties that we serve for the Dole VA. Right now, we are, as of the end of May, our goal for the full fiscal year is to house 155 veterans, but we're currently at 142 and well on our way to do exactly what we've done each year, which is to exceed that number. Next slide. An additional part of that goal for fiscal year 25 is to cut down on recidivism. So that means preventing veterans from returning into homelessness. Our goal at the VA nationwide is not to just house veterans and hope for the best, but to wrap them with services, provide them with support, ensure that they have opportunities for employment, make sure that connections are being made through our exceptional benefits office, and then support them in any way we can on a road to success. And so right now you can see we are at 1.4% recidivism, meaning that we've only had, of the 142 housed, only 2 have returned to homelessness. And also happy to say that those 2 that have returned are on a pathway to being rehoused. I'll also mention, as I have in other calls, that HUD puts out a benchmarks for recidivism, meaning returning to homelessness for high-performing communities that reach high marks for their programs, ensuring that those who are receiving federal dollars to house homeless individuals and homeless families, that they do not go over a threshold of 15% recidivism. So the HUD national benchmark is 15%. The benchmark for the VA is 5%, and as you can see, we're at 1.4, and we hope to maintain a low percent and reach that goal. So happy to report we're continuing to provide that support and continued support for veterans who do obtain housing. So next slide. To kind of give you a highlight of what happens and how, as I've been talking about this system that supports veterans, how it kind of works, I wanted to share with you a brief vignette, if you will, of a real life situation, a story that's happened just within the last month and a half. We had a 77-year-old veteran who came to Wichita from another community, another state, in fact. He received an eviction notice and then officially got evicted from his landlord after falling on hard times, being unable to pay his bills at the time. So he connected with some family and friends who said, hey, come on over to Wichita. We can support you. We'll provide you with some housing temporarily and get you back on your feet. So he took that opportunity. But when he came to Wichita, those plans fell through. And unfortunately, this 77-year-old Vietnam veteran found himself homeless. And so because we have this robust system and great partners within our community, the shelter, formerly known as the MAC, now Second Light, on 9th and Main, the veteran found shelter at Second Light. We do routine outreach multiple times a week to Second Light, and we have regular contact with our community partners, not just at Second Light, but throughout all the different shelters and day shelters that we have. They contacted us immediately, but we also met with this veteran during our routine outreach visit and did an intake, did admission to our veteran shelter on 3rd Emporia called Emporia House. And then shortly within the week, he was issued a VASH voucher through the city of Wichita and our VA homeless program. Happy to report, at the time of making these slides, he was awaiting to sign a lease, but we are now we're looking forward to getting all of his furnishings for his new apartment. So we're excited for not only this veteran, but to see how quick this happens, because this all just happened within 3 short weeks. I would say we're one of the best in the nations, and I've got metrics to show it. But we also have incredible service providers within the homeless program, social workers, nurses, and other staff that support veterans. And we're just excited to see not just this story for this veteran, but others who come through, that they've got a chance and second chance to make some success in their lives. So next slide, please. So this is also part of a national initiative set forth by our current VA secretary to what they call Get Veterans Off the Streets. Part of the initiative is a twofold initiative. It's to take those who are unsheltered in our community and provide them with shelter opportunities, whether it's through community shelters or through contracted or grant shelters that the VA provides federal funding for. So that's one track, is getting veterans from an unsheltered environment to a sheltered environment. And the other part is housing, real permanent supported housing, real housing for veterans. And so what we're working towards, and we're just less than 2 weeks away now, on July 24th, is connecting landlords and veterans for a housing surge event at the Advanced Learning Library on West 2nd Street. It'll be a great event from 10 to 3, where we have landlords that can support veterans who are in an active program like HEDBASH or SSVF, or who just need some fair market opportunities to get into housing with their income that they receive. So we are asking for more landlords to participate in this event. So if you know of any landlords or you're connected to landlords, please have them reach out through this link and connect with us so they can be part of this event. We also have community organizations that are supporting this effort, helping veterans break through some of the barriers to getting IDs, cutting through a lot of the red tape that is necessary for them to get access to funding for upfront housing costs. So we're really excited about the broad participation from community organizations in our community. And lastly, we've got city leaders and partners. We've asked them to not just support this this event, but beyond this event. So seeing this as a springboard into helping Functional Zero for veteran homelessness become a reality. So excited. If you have any questions, feel free to reach out. But thank you so much for the time, and I appreciate all you are doing for our homeless veterans. Thanks a lot.
Thanks, Kenny. You guys do amazing work, very noble work. And as my wife says, all of you in the homeless program are earning, you're earning gems in your crown. So Dole does a great job of being innovative, like I said earlier, in many different processes, looking for ways to improve communication and efficiency in an effort to improve veterans' satisfaction. Rachel Newby, one of our patient advocates in our Veterans Experience Office, is here to let you know about their service. Rachel? Rachel, if you're talking, you're on mute.
Sorry about that. Hi, my name is Rachel. I'm one of the patient advocates here at the VA, and I just want to take this opportunity to talk about the Veteran Experience Office and the services we offer. So here in the Veteran Experience Office, we provide supportive listening to veterans regarding any compliments, concerns, or recommendations about their healthcare experience. Each service line here at the VA has trained and available service line advocates to address any concerns that are experienced in real time. We offer information and contacts on community resources for needs outside of the medical health care provided by the VA. And we provide service recovery for any concerns about clinical services, staff, and/or facility appearance, and ensure veterans feel heard and valued. Our team collaborates with all service departments in the VA to uphold the greatest standards of customer service and provide the best veteran experience possible. We track and analyze reoccurring concerns raised by veterans and providing data reports to service lines to drive ongoing improvements. Primary care teams have resources to help veterans deal with increased stress, including managing stress workbooks and referrals to needed services. Next slide, please. Our commitment to veterans seeking assistance with healthcare, travel, appointments, and all other related to the benefits they are entitled to receive at the Robert J. Joel VA Medical Center to include any clinical appeals. Our team here we're here to provide attentive listening, provide service recovery, and ensure our veterans always choose the Dole VA for their healthcare needs. We strive to provide an exceptional veteran experience for our veterans from the moment they walk through the doors of the VA to the time that they walk out the door. We welcome all feedback and encourage veterans to complete and return surveys for their services received at the VA. The VEO team is committed to and dedicated to ensuring an exceptional veteran experience. If you have any concerns, compliments, recommendations, you are free to reach us Monday through Friday. We are here from 7:30 to 4:30. We are located in Building 61, Room 110. We can be reached by phone with a direct extension at 53069. We can also be reached via secure message through My Healthy Vet. And as a reminder, if you do receive a survey from an outpatient visit or an inpatient stay, your feedback is important to us. VEO, we receive all of that feedback, and every single survey is looked at. Service recovery is provided for low scores, and compliments are sent to staff and service lines. Concerns and recommendations are sent to the appropriate service lines for service recovery. Whether you've had a great experience or a concern you would like addressed, we want to hear from you because your voice does matter. Thank you.
Thanks, Rachel. Appreciate the update and information. If you've been on campus lately, you know that things are always happening here on campus in terms of construction around our facility. Nick Howard, Chief of Capital Projects, is here to talk about some of the different projects happening around Dole VA at this present time. Nick, it's all yours.
Thank you, Gene. Next slide, please. So we have a number of large projects going on around station. These 5 here on the screen are the 5 largest projects I'd like to talk through. Our Building 26 renovation is going on, and it'll improve our dental care and our specialty care services, renovating about 12,000 square feet and adding about 10,000 square feet. The first phase will end in December of this year, and that's when we'll be able to go live with the canteen and the new retail store space, as well as the dental space. The activation of those spaces will happen probably early January, February of next year. As you can see in the picture, the canteen space is planned to be quite an update from what we had previously, so we're very excited about that. The next project is our Building 60 CLC renovation. It was just recently awarded. They have started the demolition at the site and are planning to do the first addition phase of 18,000 square feet, with the renovations following the completion of that, which will renovate about 13,000 square feet. The endoscopy suite project has been awarded. It is an expansion of Building 34 to the south. It adds 3 floors to that building, totaling 15,000 square feet, adding updates to a new data center, our OINT space, our biomed team, and a floor for endoscopy suites. It'll be an excellent upgrade for our program there. The med-surg renovation is underway. We are pending a modification to finish that job. We are anticipating completing that over the next year, and that will provide new patients private inpatient rooms for the veterans staying in those spaces. And then our Building 3 pharmacy and associated ADA parking is scheduled for award in September of this year. That will add about 14,000 square feet. I'm sorry, renovate about 14,000 square feet, add about 7,500 square feet, and then also renovate about 200,000 square feet of parking, which will bring us to our next slide of the presentation. Due to all these projects that we have going around station, there is some information we wanted to highlight during this presentation. So I'm going to go through that quickly here. The areas that we're going to speak are noted by blocks. Block A is connected to the work that the city of Wichita is doing for the drainage canal that is west of our campus. A construction easement is required for them to be able to do the work they need to do over there. So the boundary of our facility has temporarily been moved east, tightening that parking, and we have adjusted the angle of the parking to facilitate that change in boundary, but it has made that area tight. So just would like you to be aware that be cautious as you travel through that corridor. Block B, we added pharmacy pickup space parking. There's a few spots there for a quick pharmacy pickup if you should need to stop by the facility and pick that up from the pharmacy in building 3. We added parking in block C for 1 hour parking for patients visiting building 61, primarily associated with the move of the offices for enrollment and eligibility, release of information, and a satellite office for travel parking over there in building 61. I will go through that more in detail later in the presentation. And then block D is the area that is closed for construction as we renovate building 60. There is no through traffic through that area due to the underground utilities that are required to be updated during the project. Block E is the area that will be renovated in that last project that I discussed, the building 3 pharmacy and ADA parking project. That area will be updated to provide more efficient parking. It'll be a larger parking lot, and it will also add about 80 parking stalls. And then block C or block F was recently added to move our employee parking further away from the hospital and provide closer parking for the veterans that visit and our veterans families that visit our facility on the day-to-day. Next slide, please. As I mentioned previously, our enrollment and eligibility office has moved to building 61. That north entrance of the building that shown in the top right-hand corner is where you'll want to enter. And then just inside that building to your right is the office itself. Release of information has also moved into that space, and travel pay, which is located in building 1, will also have a satellite office in building 61 in that same space. And the next slide is details on all of the smaller projects we have going on around station. There's a lot of littler projects from renovations to improve our medical equipment, updates with the medical equipment, updates with our restrooms, as well as some larger projects in the top 3 that are related to the infrastructure around the facility. Again, if you ever have any questions, don't hesitate to reach out to the group here in our capital projects team. And if you have any questions, let us know. Thank you, Gene.
You bet. Thank you, Nick. Really appreciate that. This brings us to the question and answer portion of the program. So first, we're going to address any questions that we may have received through the Teams chat. I don't believe that we received any from the Teams chat.
We have not.
Okay. I want to let everybody know that I am going to drop the slide deck for this presentation into the chat, and I think I just did that. We also have the ability, and I hope that anyone from outside or internally who's participating, if they'd like to look at the slide deck or the recording of this meeting, we do place it on the Dole VA external website. So the Dole VA's Wichita website. If you go to the About Us tab, which is right in the About VA network, and then that takes you to the About Us page. You'll see that there it says annual reports, newsletters, and veteran town halls. So if you click on that, it will take you directly to our 24 annual report, our newsletters that we put out quarterly, and then also the Veterans Town Hall recordings and PowerPoint slide presentations. So if you ever have a need to go back and see something that was discussed in these meetings, or if you would like to share this with another veteran friend of yours who wasn't able to make it to the meeting and would like to see what was discussed, you're always welcome to share that information. So with that, we would open it up for any questions that anyone might have from outside. Go ahead and unmute yourself and just ask away. Not
Hey,
seeing
Gene,
any. Yep.
before you move into the closing remarks, I'd just like to take a quick opportunity to also demonstrate the events page for everybody. We do list all of our events here. When we started the day, it did list the town hall, but since it's after 11 a.m., that has already dropped off. So you can find all of the events that we have coming up listed here. We get those posted just as quickly as we find out about them and they get confirmed. So just another great way to stay informed about what's going on at your Dole VA. Back to you, sir.
Thanks, Jeff. So the recording of this meeting and the PowerPoint presentation should be updated to the VA website later this afternoon or tomorrow morning. And again, thank you for joining us today. We look forward to seeing you again at our next Veterans Town Hall. Thanks and have a great day.